If you have a loved one in the hospital, you're going to want to listen to this. What's up, y'all? This is Not a Real Doc DPT, and in this video, we're going to be talking about something that oftentimes people are not very well aware of. So, if you are in the hospital right now, or if you have a loved one that is in the hospital, you need to understand when you're going to the point of getting a discharge you're going to be asked, and the discussion is going to happen with you, whether it's with the physician or the nurse or potentially the social worker for the hospital. They're going to talk with you about either going home with home health or going to a skilled nursing facility for rehab. Oftentimes patients and family members, I think, don't always appreciate the gravity of that question and the answer to that. So that's what I wanted to talk about today, to help to break down and explain to you a little bit, just a little bit of sort of the differences that you get. So if you are, I, look, well, let me come back. I understand going to skilled nursing facilities. Patients oftentimes do not want to do that. The last thing that patients want to do after they've been feeling, bad and have been getting worked on the hospital, or after they've had a surgery, is to go to another facility and continue to get worked on and feel like you're getting poked and prodded and all this, and sleeping in hospital beds and strange surroundings, etc. Everybody wants to go home. Understand that. However, um, that's that. If you go home, sometimes that can be and you can bring on bigger problems for yourself than if you had just gone to a skilled nursing facility. So there are a couple of things that you really want to think of before you think about going home. The first of those, and really probably the most important thing that you should consider, is um, does do you, the patient, or patient family members, do you have a good support network for yourself or your loved one who is a patient? If you don't have great uh, family support, if you live by yourself, if you have a family that's all out of town, and there are no friends that can step in and provide you a significant amount of care for the first, you know, day to 2 days to potentially up to a week, oftentimes, where they are somebody that is helping you to go to the bathroom, helping you to take a shower, helping to prepare meals for you, um, even helping to transport you to your physician appointments. Um, that's going to potentially be a problem. You also want to think about, what is your environment like? Are you able to move around in your environment? Do you have stairs and you're not able to do stairs right now? Is your house very cluttered and it's really hard to move around? And so it's not very safe for you to return home. That's is something that you're going to want to really want to consider. Um, and this is a big one. Are you going to be willing to do the work that it's going to take for you to recover, so that you can return to your prior level of function and return to how you were? Um, if you are answering no to any of those questions, you probably need to be going to a skilled nursing facility on your discharge from the hospital. It's probably not a good idea for you to go home. So oftentimes your patients are presented with the question of, well, you can go home with home health or you can go to rehab. Well, going home with home health, that is not equivalent to going home with rehab. You going to rehab, not going home with rehab, but going to rehab. When you go to rehab, you're getting uh, therapy every single day. Well, during the week. The weekends you may or may not get some. It depends on the facility. Uh, you go to home health, and you may be seen 1 to 2 times per week. It really depends on what your insurance is going to authorize. Uh, Home health nowadays uh, r- really requires a lot of work from the patient. Essentially, the onus is completely put onto the patient or the patient's family to actually do the exercise and do the work. When your therapist comes to visit you, or not visit you, but when they come for your appointment in home health, they're yes, they will be doing exercises with you, but they're going to show you the exercises that you need to be doing until they come in again. Depending on the type of diagnosis that you have, your insurance is going to determine how many visits they're going to get, and they're not necessarily going to give um, more than 1 to 2 visits per week. Maybe if it's like a knee replacement, you'll get 3 times a week, but that's only for a couple of weeks before you go to outpatient. So going home with home health is not anywhere close to the equivalent of discharging to a rehab facility where you're going to get all of your ADLs assisted with, all of your activities of daily living, all of your bathing, your toileting, your dressing, all of your meals. You're going to have help with all of that. You're going to get therapy, not just from physical therapy, but from occupational therapy. You might be getting speech therapy. You'll be getting that every single day. So you come into home health, as I say, it's you may have nursing, you may have PT, you may have OT. Oftentimes, it's going to be PT or OT. You're not necessarily going to have them both. Your therapy also is likely going to be um, like 1 to 2 times per week. So just see how that is being weighed out. There is if you um, or your family member is going to need a significant amount of help, you really should likely consider saying yes, that I want to go to a skilled nursing facility just for a little while. We're not talking forever and ever, amen. We're just saying, hey, go to a rehab facility. By having all of that amount of support, having all of that work being done for you, that can oftentimes boost you up so that then you can then make a successful transition home. There are so many patients that we have that will go home with home health, and then they run into issues and they run into problems. And that this is another thing. And listen to me here. This is really important that you hear this. Once you have discharged from the hospital, if you get home and you start to realize, I cannot do what I thought I did or I thought I could. I'm actually having difficulty with doing my ADLs. I am not doing the exercises like I should. I am having um, lots of trouble. I'm basically sitting in the chair the whole time. What you're going to find is, if you are needing to go back in or go into a skilled nursing facility, it is going to be really, really hard. It There are a few places, probably where you live, around that may take you direct access, um, off coming off the street into a skilled nursing facility around where we live. I can think of in within a 2-hour drive, I can think of two places that will do that. There are many there. I mean, there are probably 20 or 30 rehab facilities around in this same 2-hour area, probably even more than that. But two of them I can think of that will take a patient directly from their home into their rehab facility. The vast majority, all of the other facilities, they require you to go to the hospital first. And then you oftentimes have to have a hospital stay. It's not enough to just go to the ER. You actually need to be admitted into the hospital, and oftentimes it's a 3-day stay. Now, that could have changed a little bit on that recently, but traditionally it has been you needed to go to the hospital, you had to be admitted, and you had to be there for 3 days. And after a 3-day stay, then you could go into a skilled nursing facility. So sometimes patients will discharge home thinking, "Oh, well, I don't want to go to that rehab facility because I want to go home, and yeah, I'll just get home health." But it is not equivalent, the amount of care that you're going to be getting. And so Then once they get home, if they all of a sudden do need that daily assistance and that daily care, and if they're not able to get it from their family members, a lot of times they're stuck, and it becomes a real problem. Now you can try going back to the hospital. I have run into some really sad cases at times in or previous jobs, where you had patients that were needing a significant amount of care, and then they didn't have it, and then they couldn't get it back into the hospital. The hospital wouldn't admit them, and they couldn't get into a rehab facility. And there's some hard cases and some sad cases, when that happens. So um, I end this video by saying, when the physician or the nurse or the social worker in the hospital comes to you as you're getting prepared to discharge and asks you that question of, do I need, or do you want to go home with home health, or do you want to go to a rehab facility? Really consider and be honest with yourself what is going to be the best for you, and go in that direction, even if it means that you've got to delay actually going home for a few more days or another week or two to help boost you up to another level. So I hope that this video has been enlightening to you, and we'll be saying prayers for you and your family that everything will go well with you. And if this video has seemed to be helpful to you, if you would hit that thumbs up button and give a like to this video. And if this type of content, talking about physical therapy more from a patient perspective and how they experience it, and what they can do to be or to receive benefits from physical therapy, then do subscribe to the channel. We'd love to have you. All right, y'all have a good one. Bye.